Well, good afternoon, and thanks to all of you for joining us this afternoon. And whether you're watching on television or online, we appreciate you joining. We always want to give accurate and update information as to what's going on in our Commonwealth. To start out today, I want to talk about our COVID numbers. We'll start with some good news. This first slide here is a New York Times graphic from last week that shows Virginia as one of just a handful of states that are not showing large increases in COVID cases. As you have heard on the national news, virus case numbers are going up across our country in nearly every state. We're lucky here in Virginia that while our case counts are trending upward in some regions, we're not seeing large increases. But as we all know, Virginia is a diverse state. And in our rural areas in particular, a small increase in cases can have a very large impact. For example, Ballad Health, the hospital system in Southwest Virginia and Eastern Tennessee, is warning that it is seeing an increase in COVID patients. So while our numbers look pretty good overall, we have to consider the differences across regions of the state. And we have to slot Virginia into the bigger national picture. We aren't an island like New Zealand. Our citizens cross state lines every day, and what happens in other regions can affect us. I mentioned the Ballad Health System. Part of the issue there is that cases just over the border in Tennessee are spiking. I'd like to take a look at our numbers to show you how things are playing out in our regions across Virginia. So here you see our current case count. You can see that has started to turn more sharply upward in the past few days. Our percent positivity statewide, however, remains at 5.1%. Remember, a few months ago it was up over 20%. So let's look at how things are going in the different regions of Virginia. This shows you how the Department of Health divides the state into 5 regions. We'll start in the eastern region. During the summer, we saw a spike in the east, and we had to reinstate some restrictions in some localities to help get our numbers down. I'm pleased to say that worked. People took it seriously, and now the eastern region case counts are not spiking. And their percent positivity is around 4.1%, which is very good. Similarly, Northern Virginia had high numbers early in the pandemic, and they, as you remember, delayed lifting some restrictions until their health numbers looked better. This slide shows cases in Northern Virginia starting to tick upward just a bit, and their percent positivity is still pretty good, around 4.7%. Turning to the central region, case counts there have remained relatively steady, and the percent positivity is around 5%, which has been slightly increasing over the past 15 days. In Northwest Virginia, cases are remaining relatively steady. Their percent positivity is around 4%, a steady decrease over the past several weeks. Now, let's turn to Southwest Virginia, where the numbers are more concerning. You can see the number of cases has been steadily increasing, and the percent positivity is now just under 8% for the region, which has also been rising. In the Southwest localities, in the western end of the state, it's actually more like 9% and has been increasing for 15 days. That's twice the rate of the rest of the Commonwealth. And that, quite frankly, is troubling. Our public health experts are clear. The spread in Southwest is driven in part by small family gatherings. I strongly urge everyone in the Southwest to look at these numbers and step up your precautions. I ask you also to wear face protection. We know that that works. Case numbers are rising in most states and around the world. In other states and other countries, they're reimposing restrictions to get case numbers under better control. Nobody wants to have to do that. But this virus remains a very real threat. We're keeping an eye on this and are in conversations with our local leaders and health officials in that region about potential actions that they can take to mitigate the community spread. Local health departments are working with local elected officials and community leaders, such as our faith leaders, to reinforce the message that everyone needs to do their part to reduce the spread of this virus. I know that many people are tired of COVID restrictions. We are all tired of not having social get-togethers, not going to see sports or shows, not having the regular interactions that we count on in our lives. Most people are doing the right thing, and they are tired of seeing other folks disregard the rules and disregard the health and safety of other people. So we're taking action. You saw that in the last few days with some high-profile enforcement by the health department against 4 restaurants right here in the Richmond area that weren't abiding by the health guidelines. And we'll keep doing that. Since mid-September, we've averaged more than 15,000 testing encounters a day. Our National Guard, and I thank all these men and women, continues to help with that, and they can be deployed if we need to quickly test at places where we're having an outbreak. Today, I'm also happy to say that we have received a shipment of rapid antigen tests that we ordered through our participation in the testing compact with the Rockefeller Institution Foundation. We ordered an initial 200,000 rapid tests a few weeks ago. Last week, the first 26,000 arrived. Those are being distributed to nursing homes and long-term care facilities, and we expect more to arrive soon. And with Halloween this weekend, I want to remind everyone to please take precautions and make good choices. Some favorite Halloween activities are not cut out for social distancing. Big crowds are a bad idea. We all need to keep our guard up. As scientists learn a lot more about this virus over the past 8 months, we all learn more about how easily it spreads through the air. And we learn more about how these guidelines truly do help reduce the spread if we all follow them. Wear a face covering. Multiple scientific studies show that that helps. Avoid crowds, especially indoors. Scientific studies show the virus spreads through the air. Wash your hands. Scientific studies show it can help reduce the spread. We don't want Virginia case counts to look like most other states, and that depends on each and every one of us doing our part, caring about the people around us. Virginia, you have been doing a good job of this in the past 8 months. Our numbers show that, and on behalf of the Commonwealth, I thank you. But we all need to keep doing the right thing. We want our children back in school. We want our businesses to be open. We want to go to concerts, theme parks, and athletic events. But we want to do it safely and responsibly. And the only way to do that is to keep the numbers down in our communities. We know that while this health crisis continues, so does the economic fallout. You have heard me say that we have to fix the health crisis to fix the economic crisis, and that remains true. But that doesn't mean we can't work on both at the same time, and that's exactly what we're doing. In August, we launched Rebuild Virginia using $70 million in federal dollars from the Coronavirus Aid, Relief, and Economic Security Act to give grants to small businesses and nonprofits that didn't receive other federal help. Today, we are dramatically expanding the program, adding more money and making more businesses and nonprofits eligible. I just got off of a Zoom call with small businesses across Virginia listening to their suggestions. And one of them was to really expand Rebuild Virginia, and we're doing that. We're upping the maximum grant amount to $100,000, up from $10,000. To support that, we're adding another $30 million in CARES Act dollars to the program. Rebuild Virginia will now be open to all types of small businesses and nonprofits in Virginia that meet size requirements and other criteria, from restaurants to summer camps, from farmers to our retail shops. Small businesses and nonprofits are the backbone of our economy, and they will be the backbone of our recovery. We are committed to helping them through this difficult time so that when the pandemic is over, and there will come a day when it's over, we are already on the path to economic recovery. We're using CARES Act dollars to help Virginians, from our small businesses to free clinics to colleges and universities. So recently we announced, and you can see it on this slide, $116 million for colleges and universities to help support their COVID response. $3 million for our free clinics. $65.8 million to support child care access. $73 million for hazard pay for home health workers who provide personal care. $220 million for K through 12 to support COVID response. $30 million to fast-track local broadband projects. And $22 million for Virginia's COVID vaccination program planning. While our businesses are hurting, some more than others, so are many workers across Virginia who've been laid off or seen their hours cut due to this pandemic. In the coming days, we'll be announcing a new workforce training program that is aimed at helping folks who've been laid off get new skills for new jobs. We want to get people back into the workforce, and we're going to do everything to make that possible. While we continue to focus on the health crisis, the business of government also keeps going. This week, I have signed legislation that significantly advances police and criminal justice reform. Today, Virginia becomes just the third state to ban no-knock warrants. These reforms also reduce militarization of police equipment, standardize law enforcement training requirements, and strengthen the process to decertify officers when needed. I want to sincerely thank our legislators and all of the advocates who have worked so hard to reform our criminal justice laws so we can keep Virginia safer and rebuild trust between our law enforcement and the communities that they serve. Working with our partners in the General Assembly, we are committed to protecting people during the pandemic from being evicted and from having their utilities shut off. We'll have more to say about that very soon. I also want to take a moment to thank every Virginia resident who responded to the U.S. Census, and the census staff and everyone who worked so hard to get Virginia's census responses in. Thanks to you, Virginia had the highest response rate in the Mid-Atlantic and is tied for Illinois for the 6th best response rate in our nation. This matters. It means more federal dollars for Virginia, and I appreciate everyone who did their part. Now I'd like to turn briefly to the situation at my alma mater, the Virginia Military Institute. We've heard troubling news reports about the culture there. Last week, legislators and I announced that we will launch an investigation into the school's culture and policies. We will have more to say about the next steps in the coming days. We want to make sure that the culture at VMI reflects the values that we all hold in this 21st century. Richmond took an important step into the 21st century just yesterday when a judge ruled in favor of our effort to remove one of the largest Confederate monuments in the South, the Lee statue right here in Richmond. These monuments were put up a century ago for literally all the wrong reasons. Today, I am heartened that the judge understood what so many people are coming to understand, that these monuments belong in museums, not in the public square. So I'm privileged and pleased to have our Attorney General Mark Herring with us today to speak to this ruling. Please welcome our Attorney General Mark Herring. Mark, thank you.
Well, good afternoon, and thank you, Governor, and for giving me an opportunity to share some remarks about the important win yesterday, and thank you for your leadership. Yesterday's win is so important for Virginia and for our future as an inclusive, open, and welcoming community. The judge agreed with me that the statue was erected against a backdrop of white supremacy, to show who was in control and what the order in society was going to be. And the decision yesterday puts Virginia one step closer on the path to finally bringing down this divisive symbol. The Lee statue has held a place of prominence and stood as a memorial to Virginia's racist past in the center of our capital city, and it's been up entirely too long. It does not represent who we are as a Commonwealth, or who we've become as Virginians. And it sends the wrong message to the rest of the world that we continue to venerate an individual who fought to maintain the enslavement of human beings. We are living in a time unlike any other I've witnessed in my lifetime, where we have really begun to come together as a society to start the work to dismantle the systemic racism that continues to permeate our society. And that includes removing painful reminders and grandiose monuments that memorialize a racist insurrection. Maintaining these symbols of hate and white supremacy introduces and reinforces the false and poisonous narrative that there is a hierarchy of races. This messaging is the reason the statues like this one were raised in the first place. Something that really struck me from the testimony of one of our expert witnesses, Dr. Kevin Gaines, who explained in our society now and in the future that when we see ourselves as a more equitable, open, caring society, how does a parent explain to a child why there continues to be a massive monument to the lost cause, to white supremacy, and to fight to maintain slavery? Why does that still stand in our community? A parent shouldn't have to explain that to a child, and I'm going to continue to fight to bring this statue down so they don't have to anymore. The time for glorifying the oppression and injustice that these Confederate generals fought a war over has passed and should have never existed in the first place. Today, we are a new, diverse Virginia that stands for openness, equity, and inclusion. And I want to thank Governor Northam for his leadership on this important issue and for recognizing that bringing this statue down is an important step in the healing and moving forward that is happening right now in our community. And I also want to thank my team for their dedication and tireless work on this pivotal and historic case, especially my Solicitor General, Toby Heitens, and Jacqueline Hedblum from my Civil Litigation Division. I am incredibly proud of the work we've already done and will continue to do to ensure that this symbol of racism and white supremacy is removed once and for all.
Thank you, General Herring. Really appreciate your work. And finally, believe it or not, we are less than a week from Election Day. So I have some reminders for all of you. First, if you want to vote early in person, the last day to do that is this Saturday, October the 31st. So far, almost 1.4 million Virginians have voted early in person, and more than 817,000 early ballots have been received by mail. That puts our total number so far at more than 2 million, nearly 4 times the number of Virginians who voted early in 2016, and almost 55% the total 2016 turnout. About 36% of registered voters have already voted. You can also vote on Election Day, as usual, next Tuesday. Polls will be open Tuesday, November the 3rd, from 6 a.m. to 7 p.m. Second, if you are voting absentee by mail, that ballot must be mailed by Election Day, Tuesday, and received by next Friday, the 6th. So if you haven't mailed your absentee ballot, you should consider dropping it off by hand at a ballot drop box, which is available at your local registrar's office and other locations. Remember that ballots received by Friday will be counted. Again, ballots received by noon on Friday, November the 6th, will be counted. That brings us to an important point. With television and computers, we've come to expect that ballots are counted very fast and that results are announced on election night. But that isn't required, and in fact, that's not even the legally final count. Election officials don't call elections on election night. News organizations and cable news started doing that. Under Virginia law, elections officials must certify elections results, an event that happens weeks after the election. Local electoral boards will certify results a week later on November the 10th, and the state board will certify the election in Virginia on November the 16th. So I just wanted to remind everyone, we're looking more at an election week than an election night, and that's nothing to be alarmed about. That is the process working as the law intended. I want to ask Secretary Connor to come up and talk some more about the process and what to expect next week. And I just want to, before Secretary Connors comes up, thank her, the Board of Elections. We've had a lot of elections in Virginia, as you know, but they have worked so hard to make sure that your vote is counted and that you're able to vote safely. And between now and November the 3rd, I know a lot of us have voted in Virginia, but I encourage all of you to exercise your right. So, Secretary Connor, welcome.
Thank you, Governor. So as the Governor said, we've had a total turnout of a little over 2 million Virginians having already cast their ballot. And so my message today is to everyone who's not either gone to vote early in person or returned their absentee ballot to please do so as early as possible. The last day, as the Governor mentioned, to vote early in person is this Saturday, October the 31st. If you are not familiar with early voting locations in your locality, I encourage you to visit vote.virginia.gov for more information. The polls will be open on Election Day from 6 a.m. to 7 p.m. We have a strong partnership with the Medical Reserve Corps of Virginia that will help to ensure a safe and sanitary polling precinct for all Virginia voters. We encourage you to take your mask with you before heading out to cast your ballot. On election night, results will populate as they come in, as it has in the past, with precincts from each locality at the end of the day starting at 7 p.m. However, all mail-in voting and early in-person voting will be reported in the locality's central absentee precinct, also known as the CAP. We've given localities a cutoff time of 11 p.m. to stop processing absentee ballots for that evening. That means that localities at that time will still need to close out their machines and go through the normal end of evening process and then report those CAP numbers on election night. Some localities may report earlier than 11 p.m. It depends on the volume and timing of ballots returned. Counting will resume on Wednesday, November the 4th. The cap numbers will be updated after Friday, November the 6th at noon. Virginians should expect that the results could change in the days after the elections. Results on election night have always been unofficial. Localities will certify their results, as the governor mentioned, by Tuesday, November the 10th. And the State Board of Elections will meet on Monday, November the 16th for final certification. So once again, I'd like to emphasize patience when it comes to results on election night. We will have results rolling in over the course of the evening, but the bulk of those absentee numbers will come later in that evening or on the days following the election. Thank you.
Thank you, Secretary Connor. In closing, I want to just say that I know it's been a long 8 months. People and businesses are suffering, and we're heading into darker, colder months. Folks, we need to keep doing what we've been doing. Be smart in how you socialize, how you shop, how you act when you go out of your house. Wear a mask, please. Keep your distance from other people. I am so proud of how Virginians have stepped up during this pandemic. You can see the results in our numbers compared to other states. We just need to keep it up. This pandemic will end, but it will not end in the next few weeks or months. This winter will be hard on a lot of people, but you have done a good job of taking care of yourselves and, just as importantly, taking care of our neighbors. It takes a team effort to limit the spread of this virus, and I am, again, extremely proud of Virginians, and I say thank you. Now I'd like to ask our Health Commissioner, Dr. Norm Oliver, to speak about the health numbers, and then we'll be glad to take your questions. Dr. Oliver.
Thank you, Governor. Very quickly on the numbers on COVID-19 across the Commonwealth. We now stand at a total case count of 176,754 people. New cases in the last reporting period is 1,345. Our death count stands at 3,616, and we reported 16 new deaths in the last period. As the governor mentioned, the testing has been going well. We clocked in close to 20,000 PCR tests in the last 24-hour period, and antigen tests have been increasing as well. We had 1,325 such tests, bringing total PCR tests up to 2,761,481. As the governor mentioned, we are concerned about what's going on in Southwest Virginia, and as the governor pointed out, Health Department is working very diligently with local jurisdictions there to really try to get that community to do what we've been doing across the entire Commonwealth to help tamp down the spread of the disease through wearing our masks, washing our hands, and maintaining physical distance. Thank you.
Thanks, Dr. Oliver. I'll be glad to take some questions. Andre, thanks for being with us yesterday in Roanoke.
No problem, Governor. How are you doing?
I'm well, thank you.
Just a couple questions. I know you said that you would have more to come concerning VMI, but just wondering, number one, are you getting blowback or criticism from your fellow classmates who love VMI? And then on sidebar, you know, the cameras don't show you entering the room from the back, Governor, but you tend to come in kind of with a little bit of pep and your head up. Just wondering, how are you dealing with everything that's happening? You know, you had COVID, people are threatening your life. In Roanoke yesterday, people were riding behind you saying the worst about you. They criticized your views on abortion as a physician. And as the quarterback of the team, how do you stay motivated? How do you keep the team motivated?
Well, first of all, Andre, your smile is contagious, and so when you smile, I smile. But you know, we're in the best state and the best country in the world. We've got a great team. We no doubt have challenges, but we have good people, and we work together. And as I said earlier, Andre, Virginia has, for the most part, been part of the solution. These are difficult times in a lot of different areas for a lot of different people, but together we'll get through this. Regarding VMI, Andre, you said that people love VMI. I love VMI. It means the world to me. I wouldn't be standing here now if it hadn't have been for my educational opportunity at VMI. But we also know that these allegations that we've heard about recently and even this summer are very concerning. They're very troubling. And we need to have an independent body come in and do a complete overview, a complete investigation of talking to cadets, talking to the faculty, talking to the administrative staff, looking at the culture of VMI, and then being able to offer recommendations to our Board of Visitors. We have 17 individuals that sit on our Board of Visitors, and I expect them to be open-minded and willing to listen to those recommendations, and then to make changes at VMI as we move forward that will assure that VMI is welcoming, that's inclusive, and that all of our cadets and their families feel safe and comfortable on the premises of VMI. And I would also say, Andre, that right now VMI is being looked at very carefully and closely, but we want to make sure all of our schools and colleges and universities across Virginia look at the same issues. And one of the things that's most powerful about Virginia right now is our diversity. And our societies are becoming more diverse every day, and that's really what makes us strong in Virginia. So we were going to have this third party, this independent group come in and take a look, make recommendations, and then really make some significant changes. I think that will be better for VMI, and I'm pleased about that. And I would hope that everybody that's associated with VMI would be open-minded and want that to happen as well as we move forward.
And there's a big scar on your face and your hand is wrapped up. Are you okay?
Andre, you're something. You're getting to all my personal medical issues. As you may know, I fractured a metacarpal bone in my right hand about a week ago. I've had wonderful care, by the way, just across the street at VCU, and I'm on the road to recovery. As regarding my face, it was not associated with the hand. I grew up on a farm. I worked on the water. I've been in the sun a lot. So this is some treatment for some sun damage that I received from not wearing my sunscreen when my mother told me to.
Hi, good afternoon, Governor. My question is about the Virginia Employment Commission. Could you provide an update on the efforts to hire and train full-time appeals examiners, the backlog of cases waiting for a hearing, and how long it is expected to get through those cases?
I appreciate that question. We've had over 1.1 million, I'll repeat that, 1.1 million inquiries for unemployment benefits. So Dr. Megan Healy has literally been working 24/7, and I'm going to allow her to address that question. Dr. Healy, welcome.
Great. Thank you, Sarah, for that question about the Virginia Employment Commission and where we are today. We have given over $9.3 billion out to Virginians in benefits. At the beginning of this pandemic, our ultimate goal was to make sure that the Virginians that were eligible, we can have a streamlined process to make sure that they get their benefits. We do have currently a backlog of people that are not eligible up front in our adjudication appeals process. That number has increased. So what we're doing now is, since we've moved people from the front trying to process claims, we're looking at automation processes to work on that, and those people we're retraining to move over to the adjudication process. We've also, anyone who's in the appeals process, we've separated out if it has to have a high deputy or more of a judge to really look at complicated cases. We've moved them there, as well as trying to move as many cases through as possible.
Thank you, Dr. Healy. Mel.
Hi, yeah, you talked earlier about community spread in Southwest Virginia being related to small family gatherings. I was wondering if you could talk more about what that means, what people should understand by small, and maybe what can you do, since it's private gatherings, hard to do enforcement there.
Sure.
You covered a lot of ground today. My second question is about Tuesday, Election Day. I think that there are folks that are concerned about the potential for violence in Richmond and elsewhere in Virginia, depending on how the election goes. Is that something that you're preparing for and have any thoughts about?
Yeah, two questions. I'm going to answer the first one, and then I'm going to let either Dr. Oliver or Dr. Carey address the first question that you asked about. And I think that's a great question, Mel, as far as guidelines. What do we mean by small gatherings, and especially with the holidays upon us? So I will let them talk about that in just a second. But, you know, Mel, we read and we watch on TV everything that you do. And we want to assure all Virginians that we have prepared for Election Day. We've had many elections in Virginia, and by the way, early voting has been occurring since September the 18th. Massive numbers of people, and I commend all of them, but I think they would agree that it's been safe, and they are confident that every vote that's cast is counted. And so we want to continue to assure people that if you vote on November the 3rd on Election Day, that the polling places will be safe and that your vote will be counted. And again, we would encourage people to vote early just with we're in this COVID-19 pandemic, so please take advantage. And as you know, we've had 45 days of early voting. Do that if you can, but if you do choose to vote on November the 3rd, we do encourage, as Secretary Connor said, to please wear a mask, but it will be safe and every vote will be counted. So thank you. Dr. Oliver or Dr. Carey, yes, thank you.
Thank you, Governor. The question really was what the governor meant about small gatherings, and the question is, and what our contact tracers have told us, the question is, you know, what do you mean by that, and how small is small? And really, if you're in a different household, it may sound innocent that you're going over your brother's house and they have 3 kids in the household and a spouse, and there's a total of only 6 or 8 people. If they're from different households with different connections, that they really should be socially distanced. Can you do it safely? Yes, you can keep your mask on. Yes, you can keep 6 feet. Yes, you can use hand sanitizer frequently. But coming together as an extended family, as if you're in one household, does present risk. And again, we want people to stay connected emotionally, but we need to be clear about physical connection. We need to keep that distance if you're not in the same continuous household. So that's what we mean. And when we talk to our contact tracers, they tell us it was a group of 4 or 5 people that had dinner, but they didn't have the distance. They didn't use masks. Obviously, with eating, you've got to take a mask off, and that means you may need to spread out. And as it gets cooler, it'll be harder to do that. Folks were indeed using patios and the like, eating outside, where it's much less easy to transmit the virus. So I think the important thing, if you're not in the same household and you're getting together, it's just like at work. You've got to keep physical distance. You've got to keep your mask. You've got to keep your hand hygiene, frequent use of sanitizer and hand washings. And if you're sick at all, you need to stay home and stay isolated until it's clear what you have. Thank you.
Thank you, Dr. Carey.
Next is Tom Rousey with ABC 7.
Hey, Governor Northam, I wanted to ask you about getting back to early voting. We've seen such a wide variety of wait times throughout the state. I've talked to people in, for instance, Fairfax County at some places that have waited nearly 3 hours to vote, other people where there's been no line at all. Is there anything that the state itself can do to try to ensure that people have smaller wait times when they go to early vote? Because we have seen a lot of long lines up here in Northern Virginia.
Thank you for the question. Wait times in different satellite locations across the Commonwealth. Unfortunately, that just really is going to vary based on the locality that you live in, the population there, the date and time in which you go to vote. What I will say is the earlier you go out to vote now, the shorter that line will be on Election Day. So please make sure that you're utilizing all of the different varied ways in which you can cast your ballot. If you have an absentee ballot, you don't have to wait in line if you want to return it sealed and marked to a drop-off location or to a local voter registration office. those times are also, some of those lines are a little longer because of social distancing. So while we would like to think that we can make this as fast as possible for people, we still want to keep you safe, and we want to make sure that each voter has an opportunity to come in safely and securely cast their ballot. Thank you.
Thanks, Dr. Brown.
Governor, sort of piggybacking off of the investigation at VMI, but can you say anything to the lawsuit against Cumberland Children's Hospital and its now former medical director, and what there have been more allegations coming to light since that has been announced? Is there anything that we can expect from either VDH, from the compliance side, or from the AG's office in terms of legal action in regards to this?
Do you have any comments on that?
The question was about Cumberland Children's Hospital for Children east of Richmond. I need to learn more about the most recent allegations. There have been joint investigations both by the Virginia Department of Health as well as the Department of Behavioral Health and Social Services as a joint effort with input as well from the Department of Social Services on what track that facility would need. There were personnel issues, and there was a criminal investigation. There was a route back in terms of there was a residential area, and then there was a desire to become qualified for and certified as inpatient psychiatric beds, and there's a route to that, and there's a process in place that's underway. In terms of what additional scrutiny are needed, we need to learn. I have no doubt that the departments know, but I need to be made aware of that. Any additional points?
Thank you, Dr. Carey.
Max Thornberry with the Northern Virginia Daily. All right, we will go to Tracy Agnew with the Suffolk News Herald then.
Thank you. Congressman McEachin sent a letter earlier this week with concerns about the virus situation and supplies of PPE at Deerfield Correctional Center and Western Tidewater Regional Jail. Officials for both facilities have denied the allegations, specifically as they relate to PPE supplies. I'm wondering if any of y'all can clear up this discrepancy.
Yes, thank you for the question. It's regarding our corrections, and I'm going to have Secretary Moran from Public Safety address that. Brian, thank you for being here.
Governor, thank you. Question has to do with a letter Congressman McEachin sent with respect to one of the regional jails and then the Deerfield Correctional Facility. Again, regional jails have their own boards operated by their boards, not the state. We have received correspondence from the superintendent of that jail stating that they do have adequate PPE. As you know, the Virginia Emergency Support Team has been providing personal protective equipment through their local emergency managers to all of these jails from the very beginning back in March. That was a concern of ours to ensure the safety of the inmates in our jails as well as the personnel working those jails. With respect to Deerfield, now that is a state correctional facility, and I can tell you as of today we've been researching the Congressman's concern, and I can tell you that I'm just looking for the specific figures with respect to Deerfield. We do have 71 active cases at Deerfield right now. One offender is in the hospital. Deerfield does house many of our geriatric inmates, and so we're treating that as a nursing home. We're following CDC guidelines for nursing home. We're doing regular testing to make sure we stay ahead of the positivity situation and make sure we have that information to address it. And so we are indeed doing that. And specifically at Deerfield, with respect to the PPE, we just checked as of yesterday. The available PPE at Deerfield included 1,859 N95 and K95 masks, KN95 masks, 11,932 cloth masks, 1,751 disposable gowns, 60,000 latex nitrile gloves, go on and on, goggles. So we will communicate that to the congressman. Obviously, we want to inform him. He's been receiving complaints from his constituents, and we'll certainly do everything we can to inform him of the situation, that there is adequate PPE at Deerfield, and that's a tremendous concern of ours and will continue to be so. So hopefully that answers it, Governor. Thank you.
Governor, back to VMI, the board president has said that he does not think that there's systemic racism on campus, but some of the posts on Yodel seem to suggest otherwise. Do you think the cadets should be banned from using Yodel, and do you have confidence in the board president?
It's a great question, Laura, and Yodel is a social media that is used by the cadets, and we are well aware of some of the comments that have been made. They're very troubling, and I would hope and expect that the Board of Visitors, to include the rector, are aware of what's going on and are also open-minded, because obviously this cannot continue at VMI or any of our colleges or universities in Virginia. So not to be redundant, but this is why we've brought in are bringing in a third party to just completely look at the culture at VMI. And, Laura, a point I would make, this shouldn't be us versus them regarding VMI. It should be all of us working together to make sure that VMI is welcoming, that it's inclusive, that it promotes diversity. And so I haven't had personal conversations with the rector. I will if I need to, and I do expect them, again, to cooperate, which they have said they will, and then if there are recommendations, that those are taken into consideration and that actions are taken to change the culture at VMI.
Hi, Governor. You said that you've talked with some of the local officials in Southwest about potential action. And with cases spinning out of control in far Southwest and climbing in near Southwest, could you address what specific restrictions are under consideration and what type of metrics would trigger those actions?
Yeah, it's a great question. The question is regarding what potential restrictions are in place. And the first thing that I would say is one size doesn't fit all in Virginia. Obviously, we made changes in Northern Virginia along with their leadership. Those changes work very well. As you remember, in Virginia Beach, it was actually large gatherings. It was bars where people were congregating. We made changes on the beaches. You all remember that. And their numbers now are well below 5%. So what we're planning on doing, working with our health department, working with the local health departments, working with our elected officials, working with faith leaders, is to really see what's going on, working with our tracers, and depending on what's driving those numbers in whatever particular part of the Commonwealth it is, then we'll make adjustments. So right now, the answer to the question, we are monitoring it very closely. The positivity rate is over 8%. And if it continues to trend upward, we know what's causing those numbers, and we'll make modifications. If we need to make more restrictions, we will. But I just would reiterate that one size is not going to fit all for all the different areas in Virginia. Henry, did you have a question?
I did.
Good.
Election security?
Yes.
Against bad actors, and what is the state doing? And I guess any lessons learned from that fiber line being cut, that kind of put the Commonwealth and secret being out, that there's that line right there.
All right, and Secretary Connor is going to answer your question, and my invitation is open. You were there for the delivery of the pumpkins. If you would like a pumpkin, please come by and pick one out. All right.
Thanks, Henry. So I'm going to answer your second question first, the fiber cut. We were able to, by the end of that day, have that line completely restored We've worked with our partner here, Verizon, to ensure that that has been properly repaired. And I have to tell you, it's going to be very difficult for anyone just to access that now. That was a road project that actually cut that cable. The last time I was here, I talked about redundancy efforts that we have underway here in the Commonwealth. We do have backup circuits. We had at that time 3 1-gig circuits. We've added 2 to that, so we now have a total of 5 1-gig, where if we were to have an incident with our 10-gig circuit, that would automatically fail over to that redundancy plan, those 5 1-gigs. So we feel very confident at this moment that we have resolved that issue. Of course, we cannot predict any act of God or projects like we just saw, but it's highly unlikely that we would experience that same incident again. When it comes to election security, we here in the Commonwealth take this very seriously. We work with our state partners, of course, as well as with our federal partners. The FBI, DHS, everyone's been at the table with us monitoring our system, in addition to our Chief Information Security Officer for the Commonwealth, Mike Watson. So we all year round make sure that we're focusing in this area and look for areas in which we can continue to improve, but we do not have any heartburn at this moment.
Any other questions?
Also related to elections, obviously election officials can't prevent someone from voting if they don't wear a mask inside a polling place, but there's been the possibility raised of possibly issuing civil citations to voters or mentions if they later on if they don't wear a mask. And I'm wondering if you could speak to that as a possibility and, offer any guidance on what election officials should do if they're confronted with voters who don't wear masks.
Well, Kate, I appreciate the question. And as you know, legislation was introduced during the special session to have a civil penalty for not following the guidelines. That hasn't become law yet. So we still have the criminal charges. And again, we're not out there to put people in jail. That's not what our intentions are. So what we really encourage people to do is to follow the guidelines, and it's not only safe for themselves, but it's safe for those around them, the poll workers, et cetera. So that's the guidelines that are in place, and we encourage people to abide by those. Obviously, if someone chooses not to wear a mask, we will make all accommodations to try to allow them to vote outdoors, but we don't have any way of enforcing it if they choose to come inside. But we encourage them to do the right thing, and especially to think of other individuals. Thank you all. Appreciate you all being here today. As was said, this weekend is Halloween. Also, we set our clocks with daylight savings time ending, and so we want everybody to be safe on Halloween, especially our children. So please follow the guidelines. And then again, November the 3rd is a big election here in this country. So we encourage everybody to, if they haven't already, to get out and exercise their right to vote. That is the foundation of democracy, and that's what will keep not only our Commonwealth, but this great country of ours moving forward. So thank you all, and stay safe and healthy, and we look forward to being with you in the near future. Thank you so much.